Assalamu alaikum. My paper published in 2022 JOE by Maria et al. Titled is The Correlation of Cracked Line and Definitive Restoration with the Survival and Success Rate of Cracked Teeth. It's a longitudinal retrospective clinical study. Briefly, a cracked tooth is defined as a tooth with a fractured plane of unknown direction that passes through the tooth structure and progresses to communicate with the pulp and periodontal ligament. Diagnosing and treating cracked teeth is a challenge for the general dentist and endodontist. The aim of this study was to evaluate the factors influencing the success and survival rate of cracked teeth with cracked line in different direction when restored early with onlay or full coverage crowns. The null hypothesis was that there would be no correlation between the direction of cracked lines, type of restorations, and the survival of the cracked teeth. In the methodology, the data were collected from clinical records of patients treated between 2009 and 2021 for 11 years. Including criteria include the presence of pain during mastication regardless of the pulpal diagnosis and the visualization of cracked line under a surgical microscope. For the exclusion criteria were diagnosis of a splint tooth or vertical root fracture. Of the 111 teeth displaying cracked line, 86 met the inclusion criteria, and the factor assessed in this study were the date of treatment initiation, age, sex, percussion, sensitivity, bulb and periapical diagnosis, number, location, and extent of the cracked lines, probing depth, and occlusal interference. Protocols for cracked teeth treatment: initially, clinical inspection and radiographic examination were performed, bulbal and periapical diagnosis were reached, presence of cracked line was confirmed using a microscope, number, location, direction, and extent of the cracked line were recorded. Teeth with cracked lines extended to the pulp chamber floor or beyond the orifice of the canal, along with a probing depth more or equal to 4 mm, were indicated for extraction. Teeth with cracked lines diagnosed with reversible pulpitis received indirect pulp protection with a glass ionomer cement and were temporarily restored with a direct composite splint or temporary restoration. And after 1 week, if no sign or symptoms of inflammation persisted and the tooth responded positively to the pulp vitality test, onlay or full coverage crown was placed. Moreover, if such a cracked teeth presented with pain after being restored, root canal treatment was indicated usually and using a minimally invasive approach. In cracked teeth diagnosed with irreversible pulpitis or necrosis, or in those tooth were previously treated, root canal treatment or retreatment was initiated to relieve the symptoms. Then a direct composite splint was provided. The root canal treatment was completed a week later if there were no clinical symptoms and the cracked teeth were restored. Clinical and radiographic follow-up of all 86 teeth was performed annually. Sign and symptoms, pulpal responses to percussion test, and probing depth measurement were reassessed. The presence of sinus tract swelling and periodontal pocket associated with cracked teeth were indicated for failure. In the results, the overall success rate was 93%, and the overall survival estimate of cracked teeth restored early were 98, 94, and 55 at the first, 5th, and 11th year follow-up respectively. The direction of the cracked line did not influence the survival of the tooth. Previously treated cracked teeth, the provision of onlay restoration and the placement of post had a higher correlation with the tooth loss. Additionally, the placement of full coverage crown resulted in lower the tooth loss compared with the placement of the onlay. In conclusion, previously endodontic treatment in teeth that subsequently develop cracked lines has a negative impact on the survival rate of the teeth. Moreover, early placement of full coverage crown should be implemented for cracked teeth regardless of the direction or the number of cracked lines, because it is associated with a higher cracked tooth survival rate. Thank you.